Hello friends, welcome to Dr. Rajeev's channel. I would like to talk about something important, something that I have been talking, or most of us, all of us have been talking about for the last 1.5 years, which is about the COVID infection. But this time, I would like to talk about 3 things that matter to us in this season. We are in July 2021. It's been roughly 1.5 years since this pandemic started. Right now, the most important variant or the most dominant variant, about 80% of all cases, COVID cases in United States, are from this variant, highly contagious, severe mutant variant of the COVID infection called Delta variant. So what are the 3 things to remember? This is the topic of today's discussion or today's video. Number 1, Delta variant is the name of the mutant Delta COVID virus given by WHO. And this is the variant that has originated from India back in around December of last year, December of 2020. So from then on, it has spread to the rest of the world, and majority of the world, this is the dominant virus. So what's different, what's special about this is it's a highly contagious virus and it causes more hospitalizations. And the good thing is for people who are vaccinated, this brings to my point number 2, is for people who are vaccinated, they're still protected against this variant like the other non-highly contagious original variant. But so it becomes important for us to develop immunity, and the quickest way to develop immunity in such a crisis, in such a pandemic crisis, is by vaccination. If you already had the corona infection, you develop immunity to it. If you do not, or if you already had the virus and had the vaccination, you have developed immunity to the virus. And 99% of all severe infections occur in patients, in people who are unvaccinated, who have not yet received vaccination. Point number 3 to note is that we are still not out of the woods yet. So we are in July 2021. Projections from experts, they have done, at least in the United States, they have done 10 different projections, and they combined all these projections and gave 4 different scenarios from 10 different sources. They have put all this together and assembled them together and gave 4 different scenarios. The worst possible scenario is the one that is going to peak in October again and see hundreds of deaths again. But hopefully we don't get there, but the projections are there. So many epidemiologists and the experts in population health are suggesting or warning us to be careful about not lowering our guard too soon, and making sure that we get vaccinated, making sure that people who are in unvaccinated hubs or unvaccinated communities are educated about getting vaccinated, because they might become the breeding grounds of become super spreaders at that time. So it's important to educate ourselves about vaccination. Number 3 is we still don't know a whole lot about this Delta variant. We are still learning. We know more than what we did earlier, but we still don't know enough to say that we can control it. So as a hospital physician, as somebody who is still seeing COVID patients, I can tell that people who are hospitalized are the ones that are unvaccinated. So especially if you have comorbid illnesses like advanced age, metabolic diseases like diabetes, and other diseases that lower your immunity, like cancer, autoimmune diseases, if you're on chronic steroids, if you have diabetes, if you have chronic kidney failure, if you have heart diseases, it's important for you to get vaccinated. So make sure that you do that. So I think this is a wake-up call for some of us Especially I have made many lifestyle changes, cutting down on added sugars, um, eating more at home, fresh food, eating more fruits and vegetables, adding more greens and rainbow colors to the food, to our diet. These are the things that we can do to take advantage of the situation to improve. We almost all of us has gotten more education in health and health related topics than we ever had in our life in the last 1.5 years. So take the best advantage of this and continue the healthy lifestyle choices. Until we meet again, stay safe and stay healthy.